Good afternoon, everybody, and welcome to today's update on COVID-19 in New Brunswick. Les porte-paroles aujourd'hui dans l'ordre suivant sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Speaking on behalf of the province today in the following order: Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Rappeler à quiconque vivant au Nouveau-Brunswick que nous sommes en plein cœur de l'hiver. Mais si nous regardons autour de nous, nous pouvons apercevoir des signes qui nous donnent espoir que le printemps s'en vient. Chaque jour, le soleil se lève un peu plus tôt le matin et se couche un peu plus tard le soir. Slowly but surely, winter is beginning to loosen its grip. Our journey through this latest wave of the COVID-19 pandemic is much like this. While the virus continues to infect many New Brunswickers and our healthcare system remains under strain, we are seeing the first signs that the Omicron wave is slowing down. In the past 10 days, we have seen daily admissions to hospital due to COVID-19, a key indicator of the prevalence of serious illness due to the virus, level off and begin to decline. Today, there are 139 New Brunswickers in hospital due to COVID-19, which is a decline from the peak of 165 we saw last week. We are also seeing the number of absences by healthcare staff due to the virus stabilize. This means our hospitals will be better positioned to handle the current caseload, as well as any increase in cases that may follow a reduction of public health measures. So I'm going to show you this modeling slide. And big shout out to our epidemiology team and our colleagues at UNB. Our modeling predicts that we will be able to safely reduce public health measures if we keep the current restrictions in place for at least another week. And the blue dots in this slide show the actual course of hospital admissions since the end of November. This line has leveled off in the past week. So if restrictions were to be reduced right now, we would expect a significant spike in hospitalizations during this month, as shown by the red line. It's actually pink, but red or pink. But if we wait another week, as indicated by the yellow line, hospitalizations will rise modestly and then stabilize. Si nous assouplions les restrictions aujourd'hui, nous pourrions nous attendre à une augmentation marquée du nombre d'hospitalisations ce mois-ci, comme le montre la ligne rouge. Cependant, si nous attendons une autre semaine, la ligne jaune montre que le nombre d'hospitalisations augmentera légèrement pour ensuite se stabiliser. These are signs that spring is coming, but spring is not yet here. We must all remain vigilant to protect ourselves, our families, and our communities, our hospitals, the hospital capacity, and healthcare workers. But it appears that we are heading in the right direction. Public Health asked for the restrictions to ensure our healthcare system does not crash. And because you all followed these measures, including getting vaccinated and boosted, these actions have been effective, helping us to manage this Omicron wave. Premier Higgs will have more to say on this in a few minutes. Entre-temps, je vous encourage à faire ce que vous faites depuis le début. Portez un masque bien ajusté et maintenez une distance d'au moins 2 mètres les uns des autres en public. Évitez les lieux bondés et mal ventilés car ils offrent au virus des conditions idéales pour se propager. Stay home when you don't feel well, and above all else, get vaccinated and boosted. Vaccination has been proven our most effective tool in managing this wave, and it really does matter. Every single dose matters. I want everyone to have the best possible chance of avoiding serious illness, hospitalization, ICU admission, and death due to COVID-19. That's why I continue to urge everyone who is eligible to get their booster shot as soon as possible. To date, 46.8% of eligible New Brunswickers have received two doses plus a booster shot. For those who are who are over 50, who are at the highest risk of severe illness, hospitalization, and ending up in the ICU, nearly 72% have received a booster. This is very encouraging, but we do need more of you to roll up your sleeves. Il se peut que certains ayant reçu leurs 2 premières doses du vaccin Comirnaty de Pfizer-BioNTech attendent d'avoir accès à cette marque de vaccin pour leur 3e dose. Si c'est le cas, il n'est plus nécessaire d'attendre. À compter d'aujourd'hui, tous les citoyens du Nouveau-Brunswick âgés de 30 ans et plus peuvent recevoir le vaccin Comirnaty de Pfizer-BioNTech ou le vaccin Spikevax de Moderna comme dose de rappel. For some of you received the Pfizer-BioNTech Comirnaty vaccine for your first 2 doses, and you may be waiting until that vaccine brand is available for your 3rd dose. If that is the case, you don't have to wait any longer. Beginning today, all New Brunswickers 30 and over can receive either Pfizer, BioNTech, or Moderna vaccine for their booster shot. While these 2 vaccines are made with similar processes and are equally effective against COVID-19, we had to temporarily limit the use of the Pfizer vaccine to those under the age of 30, as there were supply issues at the federal level. There have been a slight risk of complications seen among young people taking Moderna vaccine, so the recommendation was for younger folks to get the Pfizer as their 2nd dose or booster. But while the risk is small, we followed a federal recommendation to reserve available Pfizer vaccine for those aged 12 to 29. Issues with supply of the Pfizer vaccine for Canada have now been resolved, and we will have enough vaccines to meet the demand for booster shots. If you have already booked a booster appointment with the Moderna vaccine, I ask that you keep your appointment. And this will ensure that everyone who needs a booster shot will get one in a timely way without wasting any vaccine doses. Nous offrons également un accès plus rapide aux doses de rappel pour les adolescents. Les personnes dont le système immunitaire est affaibli en raison d'un problème de santé ou d'un traitement comme la chimiothérapie sont extrêmement vulnérables à la COVID-19. Il est donc d'une importance primordiale qu'elles soient bien protégées contre le virus. We are also providing more timely access to booster shots for teenagers. Those whose immune system has been compromised due to a medical condition or treatment, such as chemotherapy, are highly vulnerable to COVID-19, and it's vital that they are properly protected against the virus. Healthy people aged 12 to 17 with informed consent will also be able to receive a Pfizer-BioNTech booster dose, but they must wait 5 months after receiving their 2nd dose. As the COVID-19 virus evolves, our strategies to slow its spread must evolve with it. We are changing our requirements for isolation and testing to meet the changing outlook for the pandemic. Currently, public health recommends anyone who exhibits any of the 11 common symptoms of COVID-19 should isolate and seek testing. Going forward, we are focusing on specific symptoms that will trigger isolation. If you have any one of these 3 symptoms, fever, loss of sense of taste, or loss of sense of smell, isolate yourself and arrange to be tested for COVID-19. If you are experiencing other symptoms, such as cough, sore throat, runny nose, or diarrhea, you should isolate and seek testing only when 2 or more of these symptoms are present. If you have only one of these symptoms, please self-monitor and seek testing if other symptoms emerge, even if they seem quite mild. You can also still get a test if you have concerns you may have been in contact with someone with COVID symptoms and only have one of these symptoms. The exception to this rule is when another person in your household has already tested positive for COVID-19, and in that instance, seek testing if any one of the common symptoms emerge, even if it seems mild. We know that the Omicron variant could spread very quickly within households. And while the earliest signs of COVID-19 will vary according to the person's age and the variant of the virus, standalone symptoms such as elevated body temperature and loss of taste and smell are specific early indicators of COVID-19. And this approach will help us more accurately pinpoint new cases, as well as preventing unnecessary absences from school and work. And this was a lot of information, so if you need to review that, please check out our website, and all of those details will be there. Nous sommes tous sans exception tannés et épuisés de la COVID-19. Nous voulons tous voir arriver la fin de cette pandémie et revenir à notre vie normale. C'est ce que je souhaite moi aussi. But the virus doesn't have these feelings or any feelings at all, and it doesn't know or care if you are done with the pandemic. This is a journey we are on together, and through our actions, we can influence its course, but ultimately it is the COVID-19 virus that will determine our route. We have come so far together, but there is still more road to travel. Please remain patient and supportive. And in fact, next week in Fredericton is Kindness Week. Please get vaccinated because we need everyone to be as healthy and safe as possible. We can reach a new normal, but we need to do it together. Thank you. Merci.
Good afternoon. Bonjour. Since our first case of COVID-19 was detected in New Brunswick in March 2020, we've been making our decisions based on new information and a better understanding of how our ability to manage the spread of COVID-19 virus and its different variants. Notre objectif a toujours été de mettre les bonnes mesures en place en bon moment pour protéger les gens de New Brunswick. C'était particulièrement important pendant les mois d'hiver, alors que les gens passent plus de temps à l'intérieur. This is why we developed our winter plan, which is a 3-level system that provides guidance and measures to reduce the spread of COVID-19 and protect our healthcare system. On February 18th at 11:59 p.m., based on advice from Public Health, New Brunswick will move to level 1 of our winter plan, which is the least restrictive level. Le Dr. Russell a expliqué pourquoi nous sommes à l'aise de passer à la phase 1. Under level 1, informal indoor gathering limits will move up to 20 people and up to 50 for outdoor gatherings. This eliminates the need for a steady 10 or steady 20. All venues will be able to open to their normal capacity with proof of full vaccination required for patrons. Patrons must remain seated. Les restaurants, les gyms et les centres de divertissement peuvent aussi ouvrir à pleine capacité en exigeant une preuve de vaccination complète. Retail and businesses can also go back to their normal capacity, but still require physical distancing of 2 meters. Spas and salons return to having a choice of requiring either proof of vaccination or physical distancing of 2 meters between patrons. Faith venues will also have a choice of requiring proof of full vaccination for worshipers or will require physical distancing, a maximum of 50% capacity, and the collection of attendee names or an assigned seating plan. One change has been made to level 1 relating to faith venues in that singing will be permitted. Whether the venue chooses to require proof of vaccinations or to operate at 50% capacity, masks are required. Le port de masque est toujours obligatoire dans tous les lieux publics intérieurs et dans les lieux publics extérieurs lorsqu'il est impossible de maintenir la distanciation. In the meantime, as of this Friday, we'll adjust current level 2 measures to allow kids' sports teams to bubble with one another team to play, which each other will be until to bubble with one another team to play each other until the 18th when sports can resume as normal as part of level 1. We're looking at the end of the winter to remove the measures that are part of the winter plan, meaning the end of all COVID-19 restrictions on businesses and the public. We will need to see hospitalizations go down as projected and ensure that our healthcare system is not placed under unnecessary strain. But the end of the mandates is certainly in sight. When we make that decision, it will be based on science, as all of our COVID-19 decisions have been. I am hopeful we'll see the end of the emergency order and further restrictions and mandates by the end of March. Nous avons travaillé très fort pour nous rendre jusqu'ici, et nous sommes à l'aise de passer aux mesures de la phase 1. Un des facteurs clés est notre taux de vaccination qui continue toujours d'augmenter. Over the past several months, we have seen the number of New Brunswickers getting vaccinated continue to grow, with 92.4% of all New Brunswickers over 5 having received at least 1 dose. That high rate of vaccination has made a difference in the severity of the disease. Booster rates, particularly in the most risk group, those over 50 years of age, are at more than 70%. With more New Brunswickers protected, we are more confident that fewer of them who do contact COVID-19 will require hospitalization, and that will cause less of a strain on our healthcare system. Nous savons que le nombre de la cas et la hospitalisation continuera d'être élevé en comparaison aux premiers jours de la pandémie. Et malheureusement, nous savons qu'il y aura d'autres décès en raison du virus. However, we are seeing our hospital admissions stabilize, and we are seeing fewer healthcare workers off work because of COVID-19 infections. This means that we are also seeing the start of decreasing pressures on our healthcare system as a result. In recent weeks, we have seen an increase in the number of deaths related to COVID-19. And I've asked the same question as many of you. Why? In hospitals around the province, the Department of Health has examined 49 deaths in our province between December 1st, 2021 and January 20, 2022. These were individuals who either entered the hospital with COVID-19 or tested positive after admission. Tout ne sommes pas surpris parce que nous avons appris. Il y a une série de facteurs qui ont joué un rôle dans le décès de ces personnes, comme leur âge, une maladie sous-jacente ou la présence de directives découlant d'un testament de vie. More specifically, of those 49 cases, 71% were over the age of 70. And of these individuals, 71% had only partial or no vaccine protection against COVID-19. For individuals with partial or no protection, approximately 73% had directives in place indicating their preference not to be resuscitated in certain circumstances. For individuals who were fully protected through vaccinations, 67% had the same directives. And of the 49 cases, 76% had at least one of the following conditions: hypertension, cardiovascular issues, or diabetes. This data helps us to better understand the recent increase in COVID-19 related deaths in our province. But while the data helps us to better understand the shift in the numbers, it is important for us to remember that these people are more than that. Each of these deaths represents a loss to our province, a loss for their family and friends, and I offer my sincere sympathies for this loss. Alors que la province ouvre peu à peu, il est important que les gens prennent leurs responsabilités et fassent tout ce qu'ils peuvent pour se protéger et protéger leurs proches. I understand that across the country right now, there is a movement by some pushing for provinces to remove restrictions. And I want to emphasize that this has not been a factor in our decision. We are simply following the winter plan we put in place a few months ago. Les provinces éteignent leur sommet à différents moments. Nous avons adopté des mesures supplémentaires après certaines autres provinces. Alors, il est tout à fait logique que l'assouplissement de ces mesures arrivera aussi un peu plus tard. This shift is something that we have been working towards, and I think letting it seem as though protests have brought us to this point undervalues the sacrifice made by New Brunswickers to get us this far. Nous savons qu'une manifestation est prévue au centre-ville de Fredericton en fin de semaine. I understand that people are frustrated with how COVID-19 has affected their lives. Je suis vraiment frustré, moi, ici. Mais certains des gestes que nous voyons à Ottawa sont inacceptables et on ne s'attend pas à cas venant d'autres Canadiens. Je fais confiance à notre police pour bien gérer la situation. We will be making changes to our mandatory order, similar to what is in place in Nova Scotia and other parts of the country. As a result of these changes, using a vehicle or other item to contribute to a partial or complete blockage of normal flow of traffic on any road or highway will be prohibited. In addition, anyone facing, organizing, or aiding in an interruption of the normal flow of traffic on a road or highway, including delivering food, drink, fuel, or other supplies, to anyone who is interrupting the flow of traffic will face fines ranging from $3,000 to $10,000 per person per incident. And for corporations who take part, the fines will range from $20,000 to $100,000. In addition, for any person who is convicted of using a vehicle to block or restrict the flow of traffic, driving privilege will be suspended for a 12-month period, and a registered owner of the vehicle, along with the insurer of the vehicle, will be notified. Tout véhicule stationné ou abandonné qui bloque une route et une autoroute peut être saisi. Je fais confiance à notre police pour bien gérer la situation, tout en respectant les droits des gens. These new provisions apply province-wide, not only to the protest plan for Fredericton. Les gens ont le droit de manifester si la manifestation est pacifique, légale et sécuritaire. Les contrevenants seront passibles de pénalités. Nous devrons trouver au juste équilibre pour nos mesures sanitaires et les réduire quand c'est sécuritaire de le faire. Et comme vous l'avez entendu aujourd'hui, nous allons dans cette direction. Right now, across the country, it is unfortunate to the trend of vaccination rates that have dropping off, and we're concerned about that as measures are lifted. Je pense qu'il faut vraiment qu'il existe, même si nous passons à une phase qui ressemble plus à la vie normale. Ça ne veut pas dire que la pandémie est finie. I wish I could say that it is, but New Brunswickers need to remember that COVID-19 is still around us, and that continuing to increase the number of individuals who are fully vaccinated will continue to be vital for our ability to keep things open. The steps we've taken over the past few months have helped to place us in a position to find a balance where New Brunswickers are as safe as possible and where our healthcare system and economy can be protected. Je sais que la grande majorité d'entre vous a suivi les directives de la santé publique tout au long de la pandémie. Vous avez collaboré. Et c'est grâce à vous si nous nous trouvons dans notre position actuelle. With your assistance, we will continue to moving forward, beginning with our move to level 1 next week, and looking forward to continue opening, to getting rid of our emergency mandate, and to move beyond COVID. Thank you. Merci.
Merci beaucoup, Monsieur Premier Ministre. Dr. Russell. Thank you, Premier. Thank you, Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your questions in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Laura Brown, CTV.
Hi, Premier. I'm wondering if the Department of Public Safety or your government, I guess, in general, has allocated any resources to help with the convoy this weekend.
Yes, our public safety office are working in conjunction with certainly the Fredericton Police, some of the RCMP, and any other resources required to ensure they have the right capability to manage the situation. I think there's been a lot learned from, as I would understand, from the situation in Ottawa and in Ontario and in Quebec and even out west, further in Alberta. And all of that knowledge will be used to help control this situation to minimize the impact on citizens.
And I guess I'm wondering, with the changes in the emergency order, do you think it will be enough? I mean, this convoy has already been planned for quite some time now. Will it be enough? Or if the convoy can continue moving, I guess, downtown, that's not, they're allowed to do that. It's more so if they stop and interrupt traffic, correct?
Yes, there will be limitations on certainly where they can travel, as I would understand. But yes, it is if they impede traffic, then that will be a problem, if they impede the movement of the public. But I think that, in addition to the emergency order, which certainly gives added capability of the police to deal with the situation as necessary, I would like to think that with the news today of moving to level 1 and the timing, and then the reality, the real possibility that we're able to move, further to be beyond the emergency order and looking at how we can manage with COVID and recognizing the issues that are surrounding that. I would like to think that the people would be looking and say, well, why are we protesting? Why are we going through this? Because we see governments moving. We've seen it out west. We've seen it across the country. And we're seeing it here following our winter plan, as we hope we'd be able to do. So you kind of wonder, what is the point at this stage? And I'm hopeful that the protesters that are there for the right reason will find no reason to be there. And the ones that do show up, we have to question why.
Thank you. Travis Fortnum with Global TV.
Hi there. My first question is for Dr. Russell. We heard Premier Higgs say that some of these protests seem to be undermining public health measures and the work that people like you have been doing for the past 2 years. Wondering how you feel seeing these protests and these convoys, which seem to go against what you've been working on.
Well, Travis, there's definitely a lot of emotion right now across the country around what's been happening with COVID over the last 2 years. And so, I think there's a certain proportion of the population that, has a level of frustration underlying some of the overall protests that we're seeing across the country. I understand that it's not clear cut. So I think that the measures that are being taken here in New Brunswick to avoid what the situation was like in Ottawa, I think are solid at this time. And so I think there's a time and a place for peaceful demonstration, and what peaceful demonstration looks and sounds and feels like is definitely very different from what we saw in Ottawa.
Mr. Fortnum, do you have a follow-up?
Yep, super quick follow-up. Mostly semantics, Dr. Russell. Is it fair to say the peak of the Omicron wave is behind us, or is the worst behind us?
So New Brunswickers have stepped up in such an enormous way during the level 3 restrictions and now in level 2. It's incredible what has been done by New Brunswickers. What has happened is that we have been allowed, with that time and with everybody following that advice, to vaccinate more people, to get people boosted. And I just really want to celebrate that success because it is really incredible. So we went from having 30% roughly of 50 plus people boosted to 69%. I mean, that is over double in terms of the protection that we needed to offer the population to really keep going through this wave, because we're not through the wave. We've hit a peak that's lower than we would have otherwise. And so now this second bump that we're going to see as a result of delaying and decreasing that peak, we have more people protected now. We also have, been working really closely with the healthcare system and the regional health authorities. We've got some volunteers that have been able to step up and help. We're utilizing those resources. That's not to say that healthcare workers in a general sense aren't very tired. Frontline workers have been really dealing with the brunt of Omicron right now, as they have with previous waves. But at least right now we are seeing a decrease in absenteeism from COVID. That's not to say that there's not absenteeism for other reasons. But in terms of allowing the healthcare system to get ready for this next peak, which again is expected, we're expecting another peak, but it's not expected to be as big as the original one. And as I showed in the modeling, we're in a better place than we would have been otherwise. So we've really done a lot as a province right now to help us move forward right now.
Thank you. Vicky Hogarth with CHCO TV.
Thank you, Bruce. Premier Higgs, Alberta has officially ended its vaccine passport policy. Saskatchewan's doing the same next week. And you said today you're hopeful we'll see an end to mandates and restrictions by the end of March. Does that mean vaccine requirements too? Is that something that's being discussed right now?
I think that as we look forward to the future, all things are being discussed, and public health is evaluating the impacts that can have on our population. And to Dr. Russell's point about our level of vaccinations, it's extremely important that those that are vulnerable do not lose sight of the need to be vaccinated. I think what the further opening and changes that will come forward. You know, we're seeing it across the country. To your point, it's becoming a reality in Canada. But the way we manage it is to keep vaccinated and protect those that are vulnerable. You saw heard the statistics I presented and who we're seeing in our hospitals and who unfortunately are not making it out of our hospitals. So that's going to weigh heavily on the decision. But yeah, I would say that certainly all factors are being considered. All measures that are in place today, how much of that needs to stay in place and what can change. So everything is being evaluated over the coming weeks.
Ms. Hogarth, do you have a follow-up?
I do. A quick follow-up for Dr. Russell. Dr. Russell, Pfizer and Moderna have both announced they will have an Omicron-specific booster shot available likely by March. What can you tell us about this booster? Can we expect to see it in New Brunswick? And if so, will fourth shot become optional for people especially people who are concerned?
Yeah, I don't have any details around that right now, Vicki, but I'm sure in the coming days and weeks we will have more information for you. We've definitely are very lucky to have great relationships with other jurisdictions who have done fourth doses. So we did actually receive some information from Israel recently, which again, we'll look at their experience, and again, we'll wait for more information at the federal level for what's to come with this new booster for Omicron.
Thank you both. Savannah Odd, Telegraph Journal.
Hi there, can you hear me okay?
Yes.
Great. Premier, you spoke publicly this week about wanting to move towards level 1 to address public frustration, the protests. Some have suggested your comments coming ahead of advice from Dr. Russell has put pressure on public health to consider political factors in their advice rather than making a choice based on health first and foremost. How do you respond to that? And if Dr. Russell would also like to comment, that would be great too.
Well, I can respond quite easily. I mean, public health throughout the entire pandemic have based their decisions, their recommendations to cabinet based on the science. And the rationale behind my optimistic viewpoint is that I was trying to discourage those people that are fully vaccinated that hope is on the way. You know, we see it across the country. We see the changes that are being made prior to this announcement today even. And we see the hospitalizations, which we said, if we can manage hospitals, we would see our winter plan was level 3, coming back from level 3, 2, and to 1. So in seeing our hospitals stabilize and seeing our healthcare workers come back to work, which has been common knowledge over the last couple of weeks particularly, it was kind of a necessary or an obvious projection to say, looks like everything is leaning in the right direction according to our winter plan. So if I can discourage 100 people from showing up who are likely vaccinated but wanted to protest for a reason that they're tired of COVID and the restrictions that went with it, I want them to say, I don't need to really go because we're moving anyway. Governments are moving. The life is going to be better. So that's the rationale behind it. And I also appreciate the rationale behind the opposition trying to make an issue out of it. I mean, that's their role in life. So, but in this case, it's can we cause people to think twice before they start blocking roads on a cause that we all want the same thing, and we're heading in that direction in any case.
Yeah, and I can just add with respect to the work that's been done in public health along with our New Brunswick Health Emergency Operations team and COVID response team and our epidemiology team and our medical officers. We have been really fortunate, again, to have such great working relationships within our system to be able to monitor the situation so closely. So for us to be able to have the data points to do the modeling is really key to what we can project Now, again, the projections and modeling aren't 100% perfect, so there's some caveats there. But it certainly does help us understand the balance between what restrictions can provide to us, what levels of vaccinations and boosters can provide to us in terms of protecting the population, and how that translates into our recommendations to government. And at the end of the day, the conversations that take place in cabinet are, again, around all of those key pieces of information. And during you know, from whatever time that we make a decision or a recommendation, and moving forward from that time, again, we're constantly reassessing all of that information on a daily basis, multiple times a day. And certainly we try to keep the Minister of Health informed as regularly as possible, and we try to keep the Premier informed as regularly as possible.
Thank you. Ms. Odd, do you have a quick follow-up?
I do. Thanks, Bruce. You said the target to remove all of the COVID measures is March end. I'm wondering what triggers or criteria you have in mind to be met before actually moving ahead with that. Is there anything specific that would prompt an earlier or a later than planned movement in that direction?
Who are you asking that question to?
I would think you, Dr. Russell, but
Okay.
either
Yeah.
way, you can both feel free to weigh in.
So the triggers for moving to different levels were really the basis for having risk assessment discussions and conversations and analyzing that data and trends. Moving out of those types of restrictions and measures also includes trends. We're also having conversations at the FPT level with our counterparts across the country. And there should be a Council of Chief Medical Officers of Health statement coming out in the next week or two around our common goals and our vision for the future in terms of gradually releasing restrictions and measures. I think we all want to land in the same place. We just won't be able to do it at the same time in exactly the same way across the country. But we do have common goals in terms of moving in that direction.
Thank you both. Natalie Sturgeon, Global TV.
Hi, can you hear me?
Yes, thank you.
My question is for Premier Higgs. Obviously, there have been a rise in protests across the country. One even landed at your house last weekend. I'm sort of wondering if you felt any pressure to avoid a situation like the one in Ottawa to move to these lesser restrictions faster or in a quicker timeline than perhaps the numbers would allow you to?
I can honestly say not at all because of the protests, because that isn't the way to make decisions. I think that the report that Dr. Russell brought forward, what we're seeing from our analysis on cases and how we're following the curves that were presented in terms of numbers and hospitalizations, and that's what makes a decision. That's where we are able to do it with confidence. I do think, however, there's a mood in the public right now that we're seeing, and I've talked many times about a balancing act. So convincing the moderate people to say, look, we need you to keep vaccinated. We want to open up. We want to get rid of restrictions. So we're all focused in the same on the same path here. But let's not do it quickly to put us back into a case where we have trouble with our hospitalizations and we further restrict access to hospitals for people that need them for very much other reasons than COVID. So short answer is I think public have been with us on this, and they want to see changes. They want to see improvements. They want to see the benefits of being vaccinated. And I think that's what we're trying to accomplish here based on the science. And unfortunately, it's moving us in the right direction for people to feel good about.
Thank you. Ms. Sturgeon, do you have a follow-up?
Yes, for the Premier again, if he'll permit me. Obviously, there's probably going to be a convoy heading for Fredericton, regardless of what was announced today. I'm just wondering if you believe the fines and the things that you will be introducing to the emergency order may heighten tensions versus what you hope it will do, which will be to maybe get people not to come.
Well, I think it gives the police the ability to act as necessary to avoid a situation like Ottawa. I think we've seen that over this past weekend in Toronto and And in Quebec, they certainly managed the protests, they contained it, and they were able to move as necessary, trucks or individuals or cars that were blocking routes so public could not access the areas they were trying to. So they managed it in a way that we're hoping, and we anticipate the same thing that can happen here, is that we will keep movement open. And this order is not unusual. It's what's been done elsewhere to give the right ability and to put teeth around the enforcement, so that, you know, if you're going to disrupt unlawfully, protests are fine in a democratic society. We expect that, and it's a way of life for us. But unlawful actions are not fine. And so we have to address that. And that's the element that we're addressing. Because as I said before, I think there's a lot of people, and I've referenced a few times the numbers that were here a few weeks ago in downtown Fredericton. I don't believe for a moment that they were all unvaccinated. But I do believe that many of them, or all of them, were tired of COVID, and they want to see a movement in a direction that they recognize that we're vaccinated. Let's get on with it. So we're just giving the police the opportunity to protect the downtown and protect individuals who have a right to move around their province and not be restricted or move around their city. And it does apply to any other activity in our province that would require that same enforcement.
Thank you. Thank you both. Justin Dupuis avec l'Acadie Nouvelle.
Oui, merci. Ma question est pour Monsieur le Premier ministre ou Madame Dr. Russell. Vous avez mentionné qu'on vise une levée des mesures sanitaires, toutes les mesures sanitaires dès le mois de mars. Je me demandais si vous pensez que c'est prudent de tout supprimer, les mesures obligatoires comme le masque, sachant qu'à peu près tous les spécialistes entendent pour dire qu'il va y avoir d'autres variants, qu'il y aura d'autres vagues de COVID à l'avenir.
C'est la question pour moi, Justin?
Vous ou Monsieur le Premier ministre,
avec mes collègues dans chaque province et territoire et avec Santé Canada et l'Agence de Santé Canada publique, l'Agence de Santé publique du Canada, on continue d'avoir des discussions chaque semaine avec des nouvelles informations, des nouvelles recherches toujours. Alors, c'est pas quelque chose qui est fini. C'est pas possible de dire que c'est fini, mais c'est d'être toujours préparé pour les prochains changements dans la pandémie. Alors, au fur et à mesure qu'on a plus d'informations, des nouvelles faits, des nouvelles données, on va continuellement faire des analyses au sujet de quelle direction et politique on devrait recommander basée sur les faits.
Monsieur Dupuis, as-tu un suivi?
Oui, je voulais juste savoir, est-ce que c'est juste de dire que les personnes au Nouveau-Brunswick qui n'étaient pas vaccinées, qui ont été infectées par la COVID-19 ont aujourd'hui une certaine protection contre le virus? Puis si oui, est-ce que c'est rassurant dans la mesure qu'on peut penser qu'on commence à avoir suffisamment de Néo-Brunswickois non vaccinés qui sont protégés contre la COVID-19?
Alors, on ne peut pas dire absolument que les gens qui ont été infectés par le COVID-19 sont protégés complètement contre d'autres variants et d'autres infections. Alors, ça veut dire que chaque personne qui a déjà eu le COVID-19, il devrait encore se faire vacciner. Alors, la protection avec seulement une infection, c'est pas tout à fait complet. Alors, pour avoir la protection maximale, il faut se faire vacciner.
Merci.
Merci.
Bobby Jean McKinnon, CBC.
Yes. Can you hear me okay?
Yes, thank you.
Thank you. Dr. Russell, you said on January 27th you expected hospitalizations would peak at about 150 by mid-February. It's only February 9th, and they've climbed as high as 165. And you've also said that the key metric is the 7-day new admissions, but that number isn't provided on the dashboard. You haven't said whether you consider hospitalizations for and with COVID, and you haven't said what the red flag number is. Why isn't this information being released, and how can the public feel assured that the situation is under control?
Well, I understand that right now our 7-day average for daily hospital admissions has been dropping. So that fact is clear to us. And again, I wasn't aware that that's not on the dashboard. But in terms of the trends, that's what we're looking at right now. And certainly with the information that we showed today around the modeling, compared to the modeling that was shown when we went to level 3 and then when we went back to level 2, the trends are in keeping with those models around decreasing our contacts by between 20 and 30%. So that was successful in terms of decreasing the peak that was originally forecast. So that information has held true, and moving forward right now with our modelization, our modeling, the projections are showing that loosening of restrictions will see another bump in hospitalizations, but it won't. It is something at this point in time is manageable, and so and we couldn't have said that before if we hadn't gone to level 3 and then level 2 and gotten people vaccinated and boosted in the percentages that have increased in that time frame.
Ms. McKinnon, do you have a follow-up?
Yes, I do. Again, for Dr. Russell, did this modeling account for BA2 now being confirmed in the province? If what can you tell us about modeling with that being factored in?
Ms. McKinnon, we could barely hear you. Could you approach your microphone? Sorry, we couldn't hear you.
Sorry about that. Did this modeling include account for the fact that BA2 is now confirmed in the province? And if not, what can you tell us about how that affects the modeling going forward?
So at this point in time, the information in the modeling is reflective of how many people would have had COVID, how many people are susceptible, what percentage of the population is vaccinated. There are many factors. And with the Omicron BA2 variant, we know that it's more transmissible. We don't have evidence that it's more severe at this point. So, and we don't have large enough numbers really to quantify that risk right now. But in terms of we do know that the population is more protected than it had been. And we also know that that we'll be continuously looking at our numbers, and any changes in the modeling that we have to make based on increased cases of the subvariant, we will do that.
Thank you. Jacques Poitras, CBC.
Hello, I'm just looking for clarification on the end of March timeline for ending restrictions, because you're talking about the emergency. The masks and the proof of vaccination are in the public health order, not the emergency order, if I recall correctly. So, and that public health order is scheduled to expire at the end of April. So for masks and proof of vaccination, is that what the Premier is referring to when he says that there's still things that need to be discussed, or is that part of that end of March timeline?
So firstly, Jacques, if I talk about it isn't an end of March timeline as such. It's like we're hoping that we will be able to see further improvements, maybe an end to the emergency order, and changes within the March timeframe. So I want to clarify that I'm not putting an end of March date on it, or none of us have at this stage. So this will be monitored going forward. And I think to your point, there is a transition here on which public health under regulation rules would continue to apply based on public health requirement, and an emergency order would not be needed. And I think, one could make that argument prior to the situation this weekend with the protests that, the emergency order potentially could be phased out. But because of these changes right now with the protests, we had to agree to extend it another couple of weeks. So that's the nuance. And I just want to clarify the point that I'm hoping that in March, sometime, and we will see changes. And for me, like the earlier the better. But it will depend on our continual ability to move forward. And those changes, as I'll just reiterate, could result in us ending the emergency order And then to compare, depending on what public health need in terms of what they would normally have for capabilities and under regulation, that we'd still be able to and need to follow those rules.
Thank you. Mr. Poitras, do you have a follow-up today?
Yeah, just on masks specifically, though, like there's been a lot of discussion that the N95s, the NK95s provide a real great amount of protection, as much for the person wearing it as from spreading it to others around them. I mean, is it conceivable that a mask order under the Public Health Act could remain in place past April as a precaution?
Hi, Jacques. We are having those discussions with our counterparts across the country and with Health Canada and Public Health Agency of Canada. So we don't have any decisions made on that. Again, we share common goals about trying to protect the population moving forward in the least restrictive way possible. So we'll continue to have those discussions.
Thank you both. Andrew Waugh, Brunswick News.
Yeah, thanks, Bruce. Premier, you said earlier this week that you were hoping that what you were going to announce was going to take the, steam out of the protests this weekend. But from what I can see, the protesters want the end of all rules now, not end of next week or middle of next month or whenever you're thinking. Do you think this is actually going to work?
Well, I guess it remains to be seen, Andrew, and I appreciate that. They want it now. No debate there. But I think what I'm hopeful is that I think a lot of people want changes and they want to see, light at the end of this tunnel. And so what I'm hopeful is that we actually separate the moderates from the group that want more than just vaccines. It may have started with vaccines, but they seem to have an agenda that can certainly deviate from the task at hand, so to speak. So I'm hoping that the moderate vaccinated individuals that were part of the protest because they just said, we've had enough of this, we're tired of it, will see that, wow, we're going to get what we want anyway. We're going to be moving in that direction. And unless there's something really unforeseen that we can all understand, the governments are getting there. But if the nuance is between now and a few or 3 or 4 weeks from now, when we actually have all of the basis to make an informed decision, makes a difference. I mean, that's kind of too bad, because I think the moderate individuals will say, okay, that makes sense to me, and I see an improvement, and we're in winter, but we're coming to spring, and we're going to be able to do more, and we're going to be able to balance our health with society at the same time. So I'm hopeful it'll make a difference, but I guess it remains to be seen over the coming days.
Mr. Waugh, do you have a follow-up?
Yep. What about kids under 5? They can't get shots. What would you say to the parents of them, when you're talking about getting rid of all the rules and potentially dropping the vaccine rules? I mean, wouldn't they be rightfully worried?
Great question, Andrew. We follow the data across the country really closely around what's happening in all populations, whether they're vaccinated or not. So as of right now, we will continue to get new information, and as we have that information, we'll incorporate that into our decision-making and recommendations. But that wouldn't be a reason at this point in time for us to make any different recommendations than we're making right now. But certainly there are many other provinces that are ahead of us in terms of, passing the peak of their Omicron wave and what that translated to in terms of hospitalizations and severe outcomes for kids. And my understanding is that the numbers are very, very low in terms of those risks. But again, we'll continue to monitor those and we'll continue to update that information.
Thank you. Alex Villeneuve avec Radio-Canada.
Oui, bonjour. Ma question est pour Mme Russell. J'aimerais savoir s'il y a eu des pressions, si vous avez senti des pressions politiques ou autres pour proposer un passage à la phase 1 la semaine prochaine.
Monsieur Villeneuve, tu peux parler plus fort, s'il vous plaît?
Oui, ma question est pour Mme Russell. J'aimerais savoir si elle a senti des pressions politiques ou autres pour proposer un passage à la phase 1 la semaine prochaine.
Non, absolument pas. Comme j'ai dit en anglais tout à l'heure, les informations qu'on utilise pour la modélisation, c'est direct des réseaux. On a des rencontres presque chaque jour, plusieurs fois par jour avec les réseaux et plusieurs fois par semaine avec notre ministre de Santé et aussi le premier ministre. Alors, il n'y a pas de surprise au niveau de quelle direction qu'on allait, au niveau de qu'est-ce qu'on voyait pour les admissions dans les hôpitaux. Le moyen de 7 jours continue à diminuer. Et c'est pour ça qu'avec la modélisation à ce moment-ci et avec tout le travail qui a été fait dans la province au niveau des vaccinations, des doses de rappel, toute la protection qui a été augmentée durant la phase 3 et aussi dans la phase 2, ça nous donne la confiance de faire des recommandations au gouvernement en ce moment-ci.
Monsieur Villeneuve, as-tu un suivi?
Oui, pour M. Higgs, j'aimerais savoir, il y a des élus conservateurs au pays qui ont appuyé la cause ou l'idée derrière le convoi de camionneurs à Ottawa. J'aimerais savoir ce que vous en pensez. Est-ce que vous appuyez la cause portée par les camionneurs?
So I think you've put it in a very appropriate manner. The idea of the original convoy or the original protest was around the concern of essential workers traveled back and forth across the border as a result of a federal requirement for vaccinations. So that was the idea, and that was the protest. And, you know, there were likely at that time a lot of very genuine individuals that were traveling that felt, I've been part of an essential service throughout this pandemic, and I was allowed to travel because they needed our services to survive. And I felt they had kind of had a reason to say, I'm still an essential service because they need our services to keep the economy going and to keep the shelves filled and people to have some necessary supplies. But I think the protest has deviated from that. I think it obviously got overtaken by a different faction that I guess one might have spend a lot of time trying to ascertain what their real motives are. And that's why I move back to the position that, you know, genuine people had genuine concerns, and we're trying to address those in a genuine way. And I feel very comfortable working with those individuals to do so. And I would say if we can separate the genuine concerns from those that have idealistic concerns that are not in the best interest of our country, that certainly must be our goal.
Thank you. Merci beaucoup. Kevin Curley with Brunswick News.
Hello. Hi. My question was for Premier Higgs. The Canadian Federation of Independent Business is calling for a plan that focuses on staying open as much as possible. With small business making a fraction of the revenues they did prior to February 2020, what clarity could you provide New Brunswick business owners for a plan that would allow everyone to plan for the weeks and months ahead?
Well, I think that's been our focus from the very beginning. And if you look at, you know, the number of I guess, restrictions we put in place throughout the entire pandemic, from the very beginning, it's been, can we keep people open? Can we keep the economy moving? And so it was with very much, thought and reality that we had to do lockdowns before. And if you remember before, we also did it in terms of zones so that we weren't impacting the entire province. So we looked at where the outbreaks were, and that was a recommendation in public health that, okay, you can do it here. But we very much limited it as much as we possibly could while controlling the outbreaks. Omicron was different with such a rapid expansion of its movement throughout the province. But I would just say to the Business Council that certainly and the Federation that our goal is to keep our economy moving. We've seen that in our province with how our province is rebounding from COVID, you know, right up there with the top levels in any province, 1 and 2 in terms of what we have seen for economic growth and movement back to normal. And our goal will continue to be to balance the requirements and work with public health to see, you know, can we keep everything moving? But right now, I think we're certainly seeing that that is the direction we're moving in. That's the direction we will stay in without any unforeseen, given any unforeseen events occurring, because we recognize the importance to people working, importance to our economy to keep moving, and in the importance that essential needs are met.
Mr. Curley, do you have a follow-up?
No, thank you. That was great.
Thank you both. Mia Urquhart with CBC.
Thank you. My questions are for Dr. Russell. An infectious disease epidemiologist that we spoke to cautioned against easing restrictions, saying there are still many unknowns, including potential new variants and brain tissue loss from COVID. So with level 1 around the corner, how do you respond to these concerns?
Throughout the pandemic, there has always been a balance that we've tried to achieve in terms of minimizing negative impacts and minimizing unintended consequences. What is different now compared to early on in the pandemic is, one, we didn't have vaccines. Two, we didn't have the data on what is happening with those negative impacts and unintended consequences. And more of that data is available now. So it makes it very clear that that balance is very delicate between, again, what restrictions and measures we need to use to protect the hospital system and at what cost. So measures and restrictions have a cost to people's mental health, to their ability to earn an income, to get educated, et cetera. And again, we have way more data now than we did before, and we will continue to receive more data on those negative impacts and unintended consequences. So it does make our decision, I guess, we have to be more careful about the decisions we make when we impose restrictions for those reasons.
Ms. Urquhart, do you have a follow-up?
I do, thank you. The province announced 5 days ago the first case of BA2 was detected. How many confirmed cases are there now? How severe are they? And what can you tell us about the vaccination status and overall health of those who have it?
So first and foremost, what we know about Omicron BA.2 is that it's not necessarily more severe than BA.1. And we do know that it is 30% more transmissible, so we could see more cases. However, it's not clear in terms of what protection being infected with Omicron, with the first variant of Omicron is towards BA2, but what we do believe is that the vaccination protection that we have right now will help prevent severe outcomes of BA2. But with respect to how many more cases, we're still waiting for that sequencing, so I don't have any updated information other than that first case.
Thank you. Thank you both. Thank you, Premier. Thank you, Dr. Russell. That concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup tout le monde.